Malaysia, negara obesiti tertinggi di Asia Tenggara.
Obesity.
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 Obesity is an epidemic.
Obesity
is really a huge problem.
Obesity.
And childhood obesity is
Childhood obesity.
childhood obesity.
The American Medical Association is classifying it in a different way, as a disease.
Assalamualaikum and hi everyone. Today, our group will present about body mass index, or we call that BMI. Firstly, we should know what is BMI. BMI is a measure of weight adjusted for height, calculated as weight in kilogram divided by the square of height in meter, kilogram per square meter. Although BMI is often considered an indicator of body fatness, it is a surrogate measure of body fat because it measures excess weight rather than excess fats. Next, what is obesity? Obesity is referring to a greater weight gain than healthy ones. Besides, obesity is a chronic condition defined by an excessive amount of body fat. A certain amount of body fat is needed for energy storage, thermal insulation, short absorption, and other functions. Therefore, we can find out overweight and obesity is by calculating the body mass index.
Hello, I'm going to explain about BMI scale. BMI is divided into two categories, which is adult and for children and teens. So I'm going to explain for adult first. BMI is calculated for adults using standard weight status category. This classification applies to men and women of various body shapes and ages. If your weight is less than 18.5, you will be classified as underweight. The normal and healthy categories will range from 24.9 to 28.5. However, if your weight is already in the 20 to 29.9 range, you are already overweight. And for the last one, obese, which is defined as having a BMI more than 40. As shown in the slide, there is an age and a normal BMI. It should be between 19 and 24 for those aged 19 to 24. Normal BMI will be 20 to 25 for 25 to 34. The BMI for those aged 35 to 44 is 21 to 26. The BMI for people aged 45 to 54 will be between 22 and 27. Following that, the usual BMI for those ages 55 to 64 is 23 to 28. The last one is for someone who is already above the age of 65 and their BMI at the weight that will be between 24 to 29. Now I will go through BMI in further detail for children and teens. Even though it is determined using the same method as an adult's BMI, BMI is interpreted differently for these two. Children and teenagers have the same BMI as adults, which is age and gender specific, since the amount of body fat varies with age and differs between genders. These variations are taken into consideration by the BMI for age group charts, which display BMI as a percentile rating. As a consequence, if the child has been below the 5th percentile, the weight status category will be underweight. It is between 5th and less than the 85 percentile for healthy weight. After that, if a child or teenager is in the 85 to 95 percentile, he or she is already overweight. For the last one is, if the percentile range is equal to or higher than the 95 percentile, the child is obese and should change their eating habit or consult a dietitian to optimize their nutrition.
So next, let's talk about how to calculate our BMI. There are two systems you can use to calculate your BMI. First, you can use metric system or standard system. Metric system is where you use weight in kg and height in cm to calculate your BMI. This is how you can calculate the BMI. I will start with metric system where BMI equal to weight in kgs divided to height in cm and you will get the BMI of your weight. Next, you can use standard system. Standard system is where you use weight in pound and height in inch. Calculate with standard system is where BMI equal to weight in pound divided to height in inch and multiply to 703 and you will get your total of BMI. To know either your weight is normal or not, you can refer to BMI chart. That's all about how to calculate BMI.
Perhaps many have overlooked this. Yes, knowing the importance of BMI and what your BMI value is will provide some benefits and advantages. Healthcare workers can utilize BMI to swiftly identify health risks. Here is why BMI is important. The first one is BMI is a good method of finding out if your weight is in healthy condition and appropriate for your height you have. It can make things easier when it comes to calculating your BMI. Next is, it will help your doctor to identify any health risks you may experience in the future if it's in overweight or obese categories. In fact, knowing your BMI can help you determine any health risks you may face if it's outside of the healthy range. You're more likely to have fewer joint muscle pains, more energy, better regulation of bodily fluids, and blood pressure. Less burden on your heart and circulatory system, better sleep, lower blood triglyceride, blood sugar, lower risk of developing diabetes if you maintain a healthy weight and BMI. Last but not least, easy for you to calculate your nutrients requirements considering age and activities taken. However, this BMI calculation does not consider other factors such as age, gender, ethnicity, and even muscle mass. In addition, it is also not suitable for determining a healthy weight for the elderly, children, pregnant women, and even athletes. Therefore, if you are one of these mentioned groups, your BMI value may not be as accurate and does not reflect the actual amount of your body fat.
Why your BMI should be normal? Your BMI is indicating your weight is in the category for adult of your height. For your height, a healthy weight range will be from 2 pounds. Maintaining a healthy weight may reduce the risk of chronic disease associated with overweight and obesity. As everyone knows, if you do not take care of your BMI, you will either be overweight or underweight. And of course, they have a lot of risk of being high and low in BMI. There are 9 risks of overweight or known as high BMI, which are cardiovascular disease, heart and blood circulation, second, high blood pressure, third, type 2 diabetes, 4, gallbladder disease, fatty liver disease, cancer, osteoarthritis, and sleep apnea. Lastly, high cholesterol. Move on to 5 risks of over, underweight, or low BMI. First, malnutrition, vitamin D deficiency or anemia. Second, decreased immune function. Third, increased risk of complication from surgery. Fertility issues caused by irregular menstrual cycles. Last but not least, growth and development issues, especially in children and teenagers. You can reach and maintain a healthy weight if you follow a healthy diet, and if you are overweight or obese, reduce your daily intake by 500 calories for weight loss. Also, you should physically active, and please limit the time you spend being physically inactive.
you.